Your Excellencies, heads of state, members of the UN family, members of the civil society, distinguished guests, ladies and gentlemen. It's important that we are gathered here a day before the UN high-level meeting on AIDS, dedicating our time to take stock and respond to the dual threat that is HIV and tuberculosis. I'm honored to be here, part of the first HIV Tuberculosis Global Leaders Forum, because, as you know, one cannot speak about the progress made in interventions against HIV and AIDS without mentioning tuberculosis. 2 decades ago, tuberculosis was a disease that we expected to control. But today, it has reappeared as a global health threat due to HIV. As we prepare to take part in this forum, several questions stand out, and it's my hope that we can reflect on them today. Are we just beginning to make a dent, as we are just beginning to make a dent in the fight against HIV? Are we well equipped to handle the dual threat that is co-infection of HIV and tuberculosis? In countries that are most affected, do we have the necessary mechanism to protect our communities? Are we, as a global community, willing to take bold and innovative steps in addressing the dual threat issue? There are no clear-cut solutions, but I'm aware and thankful of the global efforts in several areas, including research, that are ongoing in this regard. Today, I'm privileged to humbly share with you the experience of Rwanda that was once shattered as a people and as a nation. Rwanda is a country that lost more than a decade due to the effect of the 1994 genocide. In 2005, our Health Millennium Development Goals were at the level of 1992. However, in the last 3 years, the overall healthcare system underwent major restructuring, and treatment and prevention efforts were rapidly scaled up against HIV and AIDS and other infectious diseases. One of the first actions in our response to HIV tuberculosis threat was to mobilize the communities. Among communities in Rwanda, there is now a popular saying that no one can hide a cough for a long time. It's through this community-centered approach that we were able to embrace, to enhance early detection of tuberculosis at community level and alleviate the stigma attached to this disease. I must add that through the thousands of dedicated men and women who make up community health workers across Rwanda, their volunteering services have played a crucial role in this exercise. If you allow me, using a context that is familiar with you in the United Nations, I could compare them with the blue helmet peacekeepers, as indeed these are our community health keepers. Another program that has impacted the lives of communities affected by tuberculosis is the One-Stop Service Center. This has led to an increase in people testing for tuberculosis and consequently HIV. These services provide an all-in-one package from counseling, testing, care, to treatment, all on the same premises. The One-Stop Center services has contributed tremendously to improve the follow-up of patients and infection control in clinics. The success we are beginning to register in these programs was made possible largely because the Rwanda government understood early enough the importance of an integrated approach in addressing epidemics. Instead of reinventing the wheel, we have attempted to build on existing structures and create new methods of dealing with new health situations. The Rwandan response to co-infection of HIV and tuberculosis is a concrete example of this particular approach. It goes without saying that we would not have been able to do all this without the support of the UN family, the Global Fund, PEPFAR, the World Bank, and development partners. We thank you for your trust in accompanying us towards our goals. Distinguished guests, we are still far from where we need to be in this struggle. We all need to remain more vigilant than ever in the face of the deadly combination of HIV and tuberculosis, more so of resistance and multi-resistance of tuberculosis, which is not only difficult to cure, but the intensive treatment required is unaffordable to those who most need it. We have also established that the fact that the capacity to respond effectively to current threats, as well as the ability to adapt to new health crises, depends on the state of our health systems. We have no choice but to urgently invest in health infrastructures if we are to win against HIV and tuberculosis, and whichever new epidemics we are bound to confront in the future. This is especially true for Africa, where our health systems, in terms of both physical and human resources, remain fragile and often inadequately equipped to anticipate or deliver the services required in the face of life-threatening epidemics. Distinguished guests, we have seen the impact of global solidarity in dealing with global health threat and the encouragement this provides. Our presence here today indicates that we are committed to cutting the numbers of deaths from tuberculosis among people living with HIV. We need to strengthen our partnerships, especially between governments, development partners, the pharmaceutical industry, and the civil society, in the path to universal access to prevention and treatment of HIV infection and all that it entails. Ladies and gentlemen, as I conclude, I wish to commend the efforts of the committed leaders present here today, working in solidarity with others around the world to influence the global response against HIV and tuberculosis. With the will and resources, we indeed have the capacity to change the course and break free from these epidemics and to put an end to the suffering of affected communities. I thank you very much.